Today on Cancer Buzz, an award-winning model for cancer screening. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Today's episode continues our 6-part series on the 2023 winners of the ACCC Innovator Award. The goal of the ACCC Innovator Awards is to highlight cancer care programs that improve access, quality, and value, and provide a resource for other cancer programs to replicate. Our guest joins us today to talk about a new model for demonstrating sustainable outreach for cancer screening. Dr. Michael Gieske is the Medical Director of Lung Cancer Screening at the St. Elizabeth Virtual Health Center in Fort Mitchell, Kentucky.
It's not just the number of screens we're doing, it's the results that we're getting. We probably are on track to screen this year about 45 to 50% of the eligible population that qualify for lung cancer screening. And that compares very favorably to the national rate of 6.8%. And we're finding, for example, last year we found 70% of the lung cancers in stage 1. And when you find a lung cancer in stage 1, you have a much greater chance of curing that cancer, greater than 90% chance of curing that cancer. We found 78% of the cancers we found last year in the early stages, stage 1 and stage 2. And similar results when you look at cervical cancer screening, breast cancer screening, colon cancer screening. If you can catch it early in that first stage 1, stage 2, tremendously greater odds of curing that cancer.
ACCC was identified by the White House for its efforts to create the Rural Appalachian Lung Cancer Screening Initiative, an initiative of ACCC's Appalachian Community Cancer Alliance. How is St. Elizabeth Cancer Center improving health equity in the Appalachian community?
So we looked at the whole Appalachian region, and we wanted to target an area that had the worst of all worlds, the worst mortality, the worst incidence of lung cancer, the poorest access. And all indicators pointed to an area where Kentucky, West Virginia, Virginia come together. So we picked a 10-county area in that tri-state region that has specifically those qualities. And we have begun to reach out to hospital systems, medical groups, federally qualified healthcare centers, and community partners in this area to benchmark what the performance is presently, what the present state is with respect to lung cancer screening, and then look specifically at means and processes we can put in place to improve the lung cancer screening in these areas. And we are ahead of schedule. We've identified most of our target groups that we're going to be working with in this pilot region. And we've developed a tool that we're going to be using to evaluate these programs and to monitor progress. And we have started processes to work with these providers, hospital systems, and community partners to collectively collaborate and improve lung cancer screening in this area.
Many cancer programs struggle with how to fund screening services, especially for those who are uninsured or without the means to pay. Can you talk about making the business case for these services and how you have been able to grow your screening efforts?
Well, that's kind of two components. One is there's always going to be patients, unfortunately, that are underinsured or uninsured. And we have mechanisms, for example, in our state of Kentucky, through community partners, for example, CancerLink, that help to fund these underinsured and uninsured patients. We have financial advisors and consultants that work with patients and develop payment plans or find alternate means of paying for those services. The other thing that's really important to realize is that we've demonstrated through a financial analysis of our screening programs that colon cancer screening, breast cancer screening, and lung cancer screening very definitively have a net positive revenue. There's a return on investment for every lung cancer screen we do, for every mammogram that we order, for every colon cancer screen that we do. And the more you do, the more volume is generated and the better financial case you can make for supporting your screening program. We now employ 3 full-time lung cancer screening nurse navigators in our healthcare system. We have just hired our 3rd dedicated thoracic surgeon. Our program has grown really exponentially since we started our program back in 2013. And it's clearly through a team-based effort that has demonstrated the value of lung cancer screening, certainly for our patients and for our community, but also for our healthcare system.
Dr. Gieske and his colleagues will present the St. Elizabeth Virtual Health Center model for demonstrating sustainable outreach for cancer screening at ACCC's 40th National Oncology Conference that's held October 4th through the 6th in Austin, Texas. You can find a link to register in the show notes. Make sure to follow this channel so you're the first to know when we release each new episode in this series. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.